Welcome to the Woman's Connection. I'm Barrie Switzen, your moderator. The Woman's Connection is a program about events shaping women's lives and helping one gain authentic power on a personal or professional level. So won't you stay tuned?
Welcome. We all want to stay young and youthful, especially according to Madison Avenue. We all have to be young. With me today is Dr. Shirley Madhere, and I would like to say welcome. Welcome.
Thank you for having me.
It's my pleasure. Let's just start at the beginning. How did you decide you wanted to become a plastic surgeon?
Well, that's an interesting story, and thank you for asking. I am a former ballet dancer, and although I say former, I think that dancing is still in my bones, and sometimes I still feel it in my joints. But nonetheless, I'm a former ballet dancer, and I think the reason why I chose to go into ballet dancing was because I have a fascination and a love of the human body and how it works. So after dancing for about 8 years, I switched careers because I wasn't getting as much intellectual stimulation from dancing as perhaps other dancers do. So I tried to align myself with what I love to do, with my fascination for the human body, and for my need to work with my hands and to actually contribute to society. So one thing led to another, and on all of my college essays, I wrote that I wanted to become a dancing doctor because I thought that that combined everything that I wanted to do in life. But lo and behold, the two disciplines really could not be matched that well, and so as time went on, I focused more on one career than the other, hence my decision to go into medicine.
That's phenomenal. What a change.
Yeah, quite.
Now, you do a lot of plastic surgery.
Yes.
Do you have more women or do you have more men come in for surgery?
Well, plastic surgery in general encompasses quite a bit. So there's reconstructive plastic surgery and there's cosmetic plastic surgery. Those are probably the two biggest categories that most people are familiar with. So in reconstructive plastic surgery, the patients represent a wide demographic: male, female, trauma accidents, infants with cleft lips and palate disorders, hand surgery from workers, working injuries. And cosmetic plastic surgery is elective for the most part, and the demographic is a little bit more narrow in cosmetic plastic surgery, although I do believe that the quest for beauty or the search for ever youthful appearance is quite global. But in cosmetic plastic surgery, most of the patients tend to be women.
When somebody comes in and they say, I want my face lifted, my chin lifted, or whatever, what is the first thing you really tell them about it?
Well, the consultation really has its own anatomy. And when a patient comes in to see me, it really is not so much necessarily about what I could do for that patient, but what that patient has been doing for him or herself, and we'll just assume that this patient is female. So I try to take a very holistic approach to my patient care, and I will often ask my patient, in terms of someone who's looking for a facelift, what it is that they're doing to try to put their best face forward. So I will inquire about their habits in eating, exercise, whether or not they smoke, their skincare regimen, whether or not they avoid the sun and they use sunscreen. And then at that point, I'll find out about their social or psychological motivations for wanting to undergo plastic surgery. And once we get through that, if they prove to be an appropriate candidate, and by appropriate I mean physical, physiologic, emotional, psychological, then we can move on to the details and the specifics of the operation in terms of where the incision is made and healing time, etc.
All right, somebody passes your criteria. How long from the time that you have this consultation, they go under the knife, the time that they're actually healed?
That is a great question, and I think there's a lot of misconception about what healing actually is. I know there's some television programs where patients undergo an operation and within 6 weeks they're looking uber fabulous, but actually healing is an ongoing process, and healing, or at least in terms of how long it takes for a scar to mature, occurs over 1 to 2 years.
Wow.
So Healing actually does take place in stages over the course of several months. A scar or an incision will continue to change over those 1 to 2 years after an operation.
Now, is there a special procedure you recommend your client to do while they're healing on the scar?
I try to take a very holistic approach to healing because I believe that not only that beauty emanates from within, but healing occurs on the inside out. So in terms of healing after surgery, I will advise my patients to try to stay as healthy as possible before the operation and to try to continue that post-operatively. So this will typically entail a regimen of eating increased fruits and vegetables, more antioxidants, increased hydration in terms of taking in more water to drink, vitamins and mineral supplements, and sometimes some homeopathic or all-natural medications to try to improve the way that the body heals the scar after surgery.
I've been reading a lot about vitamin D. How much does one take? Does it really play that importance of a role in our healing?
Vitamin D is important for us and our bodies because we do not make it. So we have to take in vitamin D from the sun. Well, let me go back on that, sorry. Vitamin D is important in our immunity, and vitamin D is something that we need to be able to make by using the sun. So I know there's been a lot of controversy about how much sun should we be exposed to because of the possibility of skin cancer, and this is all relevant, but our bodies do need sun exposure to be able to make vitamin D. I tell my patients that as long as they are not undergoing prolonged and unprotected sun exposure, then they should be fine with 10 to 15 minutes of sun exposure about 3 times per week.
Well, that's all good and fine in the summertime. How do you get that kind of exposure in the wintertime?
Even though it's wintertime and sometimes it's cold and cloudy, the ultraviolet rays from the sun do get through, and they certainly do get through our ozone layer in more and more increasing amounts. So I would not recommend that patients go to a tanning booth or a tanning salon to try to get that extra sun, because believe it or not, we do get it from daily sun exposure.
What are your favorite antioxidants that you recommend to people take?
Antioxidants are the latest buzzwords, not only for beauty, but also for overall health and wellness. And some of the more popular antioxidants that are readily available include vitamin E, pomegranate, omega-3 fatty acids, which we can get from fish and salmon, and there are a whole host of others, including grapeseed extract or resveratrol.
Resveratrol? I never heard of Resveratrol.
Yeah, resveratrol. It's one of the newer antioxidants that's derived from grapes or wine, but primarily grapes. And that's been shown to be a very potent antioxidant. So I know that there are a lot of people who take resveratrol supplements on a daily basis.
Wow, wouldn't it be easier just to drink wine?
It probably would be easier to drink wine. However, the manufacturers of the supplements do claim that you would not be able to get as much resveratrol as you need from drinking 2 glasses of wine per day. So they certainly recommend that the supplementation is probably the purest form of antioxidants that you can get.
Somebody has come in and you've done some plastic surgery for them. How long, let's say, does a facelift technically last?
I often have my patients ask me how long certain results will last. And that will very much depend on what the patient brings to the table as well as the particular technique. In general, as long as a patient is healthy and is an appropriate candidate for a facelift and really does all the things that are important to help that person to age well, one may get anywhere from 5 to 10 years of results or longevity out of a facelift.
You're saying 5 to 10 years?
5 to 10 years, depending on a number of factors. But typically, a facelift is something that is relatively definitive, and I say relative because while a facelift may allow you to anti-age to a certain extent or manage your age for several years, it may or may not need to be tweaked after 7 to 10 years.
What if a patient comes in and says, I want to be tweaked, before you think they should be tweaked? How do you resolve that?
Well, I try not to use the word tweak, but perhaps a refinement or a touch-up or a surgical modification. But yes, sometimes patients actually become very used to the effects of the surgery, and they are positively reinforced by the positive comments that they're getting from friends or family, and they love the idea that they're looking well. And if you look well, sometimes that feels and people feel great. So if a patient would like to have a refinement or a little touch-up or a tweaking, and perhaps it really isn't time, then there certainly is a conversation that must take place. And there's also some education or re-education that must take place as well. And certainly there are some things to discuss before one were to undertake re-operation for whatever reason.
Because I know you walk around the city here and you see people so tight. It's like, how do they chew their food?
Well, it's very interesting. I think that beauty and one's beauty philosophy is very personal and highly individualized. So what may be considered too tight for one person may be not tight enough for the other, which is why I think it's important to be able to interview your plastic surgeon and make sure that you and he or you and she are on the same page when it comes to aesthetics and how things should look.
What are some of the criteria somebody should look for when they're looking for a plastic surgeon?
There are a number of criteria, and one of them is certainly to make sure that your plastic surgeon is well trained and has credibility. Another one is to make certain that your plastic surgeon has privileges at an operating facility. Another criterion is to make sure that you get along with your plastic surgeon and that you can see eye to eye. And although this is a professional that you are seeking advice from, it really is important to be able to understand that plastic surgeon and to make sure that your goals are similar and that you can see eye to eye in terms of your ultimate aesthetic outcome.
Are women still doing a lot of tummy tucks? And what are the side effects of tummy tucks?
In general, body contouring procedures are very much stable and even on the rise. So body contouring procedures include tummy tucks, liposuction, breast augmentation, breast reduction, anything that would change the shape of one's body. And as with any operation, there are certainly limitations to what a plastic surgeon can achieve, which is why it's just as important for that patient to bring his or her best self to the table, and there are certainly potential complications. Now, there are side effects to operations, and those are the things that we anticipate, and those are things that can be very well managed with proper education and really being a team member with your patient. And there are also potential complications which we don't anticipate, but certainly with education, then those can be managed as well if they even occur. As with any operation, there's always the potential for bleeding and bruising and discomfort and clearly a scar, especially if an incision is made. But potential complications which don't necessarily happen, that may include excessive bleeding or an abnormal scar or delayed healing of any kind.
What is the best way to get rid of black and blue marks? Of black and blue, you have a surgery, you have a tummy tuck, you have a facelift, and you're going to be black and blue. Is there some quick healing process?
Healing is certainly going to depend upon the patient and the genetics of that patient and the patient's lifestyle and dietary habits, believe it or not, and all those things that are components of a healthy person. But there are some things that you can do to speed along the recovery process. And as with any procedure, whether surgical or non-surgical, meaning fillers or Botox or other injectables, there is always the potential for black and blue or a bruise, or what we call in medical terms ecchymosis. However, there are some things that we can do to help reduce the time that one is bruised or perhaps to help prevent it altogether. And one of those things is clearly technique dependent. And the other things that the patient can do is to undergo massage, undergo manual lymphatic drainage, and that helps to improve the body's efficiency at getting rid of swelling and bruising. And there are also some all-natural homeopathic medications that a patient may take to help reduce the time that one is bruised.
Wow. Gotta tell you, there's a lot to think about.
Definitely.
What is new and exciting coming down the pike as far as procedures go or people are asking for?
I think the world of plastic surgery and cosmetic medicine is so dynamic and, for me, very interesting and fascinating. It really, I love what I do. And one of the reasons why it's so dynamic and fascinating is because there really has to be a marriage between science and technology and plastic surgery and using our hands. Some of the more exciting things that are coming down the pike include new and improved fillers, or fillers that would help to add volume to your face or your body and last longer. So there are also some new laser technologies that are coming along where they may actually complement surgery or help to reduce surgical times. And there are also other technologies in terms of skincare and new ingredients that may help to improve outcomes after surgery.
Now you say new ingredients. Can you share with us some of the new ingredients?
Well, one of the new technologies in terms of skincare involves stem cells. And stem cells are cells that we all have in our bodies that are cells that can actually be programmed to become different things, or can be programmed to help the body do other things, whether it's skin regeneration or improved scar healing, etc. So the stem cell technology is very exciting because we may be able to harvest or remove some of these stem cells from liposuction and be able to reprogram some of those cells to help stimulate collagen and perhaps give us more firm, tighter skin.
Wow. Does this work on older people, younger people, or who's the market? Well, I shouldn't ask that. The market would be the older generation.
Well, actually, the market is much wider than that, because not only would it be the older generation, perhaps that generation who is interested in managing age well, but also the younger generation that is interested in perhaps preventing some of the natural and inevitable changes that will occur with aging.
One of the things that does happen to us as we age is we get the sunspots, or better known as liver spots, especially predominantly on your hands. Yeah. Is there something that somebody can do without having surgery to eliminate these sunspots?
Absolutely. And they're very basic things that one can do to try to prevent the occurrence of these sunspots. Clearly, one of them would be to avoid prolonged, unprotected sun exposure. And despite your dose of vitamin D from the sun, it's important to be able to wear a sunscreen on a daily basis. At that point, also, if you're doing that, it's important to add an antioxidant or a natural skin lightener or skin brightener, such as vitamin C. And a vitamin C serum will certainly help to brighten the skin over time and will actually also help to stimulate collagen. So while it is a natural product and it isn't necessarily the strongest product that you may use to help improve sunspots or pigmented spots, it certainly will help to reduce the incidence of those sunspots or hyperpigmentation overall and over time.
I am so lost in what you got to do to keep youthful. It's like you need a chart. You need a chart for what you need to do in the morning, the afternoon, and the evening. It's like the medications and everything else you got to do. New Yorkers are stressed, so that plays a havoc with your complete system. It also changes your face. You get more lines. You get dark circles under your eyes, which I'm always using makeup. So let's start with the dark circles under your eyes. What can you do to eliminate them?
I agree with you completely in that stress definitely plays a major role in how we age. I often ask my patients to, or daily, tell them to manage their stress often and effectively, because stress will certainly have effects internally, and those internal effects will certainly be manifested at some point externally. And those external manifestations will occur in the form of fine lines, deep lines, wrinkles, sagging skin, and a whole host of other things, including decreased immunity and increased susceptibility susceptibility to illness. So managing stress is very important. Now, lack of sleep certainly contributes to under eye circles and dark circles. A relative state of dehydration and not staying well hydrated and drinking enough water contributes to dark circles and under eye circles. And stress contributes to at least fine lines and wrinkles around our eyes, and often this is where we age first, around our eyes. So in addition to perhaps using creams and lotions and potions to help improve the appearance of the eye area, if that's not your philosophy and if you're not interested in using creams or going to the next level and perhaps getting laser therapy or injectables, there are things that you can do right at home, and they're relatively simple, and frankly, they're better for your health. So get more sleep, manage your stress daily and frequently, drink more water, and try to have a positive attitude.
I like the positive attitude, especially in New York. We all need that. As we age, things start to sag. You get the wrinkles, as we've just spoken about. What else can somebody do to stay young?
Youth is quite a vast arena, and I try to take a holistic approach with my patients and try to address age management on many levels. And the most basic level really does start with the patient. And it starts with adequate exercise. It starts with a strong mind-body connection. It starts with having faith, and it also begins with nourishing your spirituality. I also try to counsel my patients to eat well and maintain a balanced diet, to exercise regularly, because a healthy heart is a strong heart. And then on another level, it's important to be able to be present and try to maintain a positive attitude even when things don't go well. And that's very difficult to do, but that's related to managing your stress. And then yet on another level, if you'd like to take it there and consult with your dermatologist or plastic surgeons, there are also so many things that one can do in terms of fillers and other interventions, injectables and plastic surgery and cosmetic dermatology. The options are numerous, thankfully, but it's always best to try to build a steady foundation and to start with the basics first. And at that point, once you start to like what you see, you can always add on.
What products would you suggest somebody have for a daily regimen on their skincare?
Well, we start to age in our mid-20s, and that begins to manifest on our faces by age 30. And everyone is built differently genetically, but at some point we will all start to show signs of aging. In terms of aging well and managing your skincare regimen, it really doesn't matter which brand you use. What is important is what ingredient or what ingredients are involved in your skincare. And the most basic would have to be any cleanser of your choice, as long as it doesn't damage your skin or overstrip it or dry it out. And then the next important ingredient would be an antioxidant serum, ideally vitamin C and or E, and that will help to even out skin tone and stimulate collagen and help to build firmness over time. And also the vitamin E as an antioxidant will help to fight off what's called free radical damage, and that's thought to contribute to facial aging. And then a good moisturizer, and ideally a moisturizer in the day should include an SPF or sun protection factor. For those of us who are 30 and over, I would recommend a vitamin A based product or a retinol based product at night, and that is a prescription product. So in general, you don't have to spend a lot of money or a lot of time having a really solid skincare foundation that will help to carry you through in your age management regimen for many years to come. And certainly this is something that you can consult with your dermatologist or even your plastic surgeon about, and that will hopefully be very helpful to you.
Shirley, let's talk about keloids, or people who are susceptible to keloids.
Well, a keloid is an example of an abnormal scar, and it represents excess collagen that's made during the healing process. Not everyone is susceptible to keloids, and frankly, as plastic surgeons, we have some idea of who has a tendency to form keloids or abnormal scars, but we certainly cannot predict that. Sometimes a keloid or an abnormal scar may form on one part of the body after surgery, but not on another part of the body after surgery. But in particular, patients of color or patients who have a high melanin content or who have some pigmentation may be at risk for keloid scars depending on a number of factors, meaning whether or not they formed keloid scars in the past, or whether or not they have a history of forming them, or family, or genetically whether or not they're predisposed to that. However, with appropriate education and with appropriate preoperative preparation and also postoperative management, the incidence of keloid or abnormal scars can be minimized, although it may not necessarily be able to be reduced to zero.
So how do you get rid of keloids?
Scar management is a field within plastic surgery that is a very common a question amongst patients. And as plastic surgeons, we certainly deal with that on a daily basis. Scar management involves anything from how does one make a not so pretty scar more appropriately aesthetically pleasing, and all the way to how do we manage painful, hypertrophic or large or abnormal scars. And there are a number of therapies that plastic surgeons may employ to help improve how scars look. It's really important for patients to know that a scar may never be completely taken away. What we as plastic surgeons do is that we improve upon the scars, we improve upon them functionally and aesthetically or cosmetically, but in fact we're actually changing the shape or morphology or configuration or the appearance of one scar, hopefully for a better, more functional, less irritating and less problematic scar. And we employ techniques anywhere from using silicone gel sheeting to certain types of medications, to injections, and even to surgery and perhaps laser therapy to improve upon those scars.
Thank you so much for joining me today, Dr. Shirley Madhere. I really appreciated all this information, and I'm going to be starting a vitamin regimen very soon.
Thank you for having me.
If you have any questions, please write us here at the Women's Connection, and Shirley or I would be very happy to answer any of the questions. Thank you for joining us. Bye now.